20 years old, did not get formal education, housewife with A positive blood group, married for 2 years to Mr. Azam, who is laborer by profession. Its first consanguous marriage of both partners. Resident of Janawala, 1.5 hour distance from the Index Hospital. She is priming gravida. She is not sure of her last menstrual period, cannot correlate it to any Islamic or calendar events, did not remember the date of any scan or event of pregnancy, but according to a rough estimation, she is at 35 weeks. Presented through outpatient department on 25th of this month with complaint of raised blood pressure since 7th month of gestation and reduced amount of fluid around baby, diagnosed 1 week back. It was spontaneous conception confirmed by urine for pregnancy test done on 5 days overdue by staff. On no history of excessive nausea, vomiting, fever, flu, rash-like illness, vaginal discharge, or spotting. Dating scan done and she was reassured. Blood pressure was not checked and no urine or blood test done. She has not taken folic acid. Quickening felt at 5th month of gestation. Anomaly scan not done. She has not injected. She has been injected for tetanus toxoid twice. She booked herself in 7th month of pregnancy at a private clinic where her blood pressure was found to be raised, but she didn't take any antihypertensive. However, blood and urine investigations not done. Scan was done and she was reassured about that. No history of polyuria, polydipsia, polyphagia, or family history of diabetes. She complains of easy fatigability and tiredness for 3 months, which has worsened to the extent that she cannot do her routine daily activities well, but no associated shortness of breath. Her diet is deficient in meat, egg, poultry, green leafy vegetables, and fruit. No history of pica intake. She has not taken hematinics regularly. No history of bleeding from any body orifices, perennial itching, or passage of worms in the stool, indigestion, or recurrent vomiting, malaria, TB, or drug intake, or any other chronic disease, chronic illness. She complained of decreased abdominal growth according to her month of gestation. She since start of the ninth month. According to her, her blood pressure was raised. No history of excessive exercise, excessive tea or coffee intake, smoking or frequent painkillers, diabetes, heat or cold intolerance, cardiac, chronic kidney disease, repeated blood transfusions, coagulation disorder, or uterine anomalies. She and her husband height are normal. No family history of stillbirth, short for gestational age, and anomalous baby. Her on her routine scan done at private hospital 1 week back showed decreased liquor, and on that visit her blood pressure was found to be raised, and so she was referred. Range not known to my patient. She was referred to Index Hospital for further management. During hospital stay, her blood pressure controlled on tablet methyl dopa, one tablet 3 times a day, once or 2 times blood pressure being checked. No history of severe headache, epigastric pain, blurring of vision, abdominal pain or vaginal bleeding, shortness of breath, sudden swelling of body, or fits or loss of consciousness. Her blood and urine investigations were normal. Her hemoglobin was 9 gram per deciliter, on which no further investigation for the typing of anemia was done. 24-hour urine collection not done. Scan showed decreased liquor. Doppler scan not done, according to my patient, and she is perceiving normal fetal movements, and further plan of management not discussed with my patient. Age at menarche 14 years, menstrual cycle 5 by 22 days, regular with average flow, no history of dysmenorrhea, dyspareunia, intermenstrual bleeding, or postcoital bleeding, no history of contraception, pap smear never taken, no personal or family history no personal history of chronic hypertension, diabetes, thyroid, chronic kidney disease, and no two of her uncles are hypertensive. She is non-smoker, non-addict with normal sleep and bowel habits, no known drug allergies. She lives in rented house of 3 marla with joint family. Basic necessities of life met with difficulty. On examination, a 20-year-old lady sitting comfortably on couch, well oriented in the time, place, and person, with body mass index of 26 kilogram per meter square, pulse of 88 beats per minute, regular with good volume, blood pressure of 130 by 90 millimeter of mercury. She is afebrile with respiratory rate of 14 breaths per minute. She is pale, no jaundice, clubbing, cyanosis, chylonychia seen. Orodental hygiene satisfactory, thyroid not enlarged, all accessible lymph nodes not palpable. No, normal vesicular breathing with no added sounds, apex beat in the fifth intercostal space in mid-clavicular line, both heart sounds audible with no added sounds. Both breasts are symmetrical with everted nipples, no mass palpable in all of the four quadrants of breast. Abdomen is protuberant with central inverted umbilicus moving symmetrical with respiration. Striae gravidarum and linea nigra seen. Hernial orifices are intact. No scar mark or visible pulsation seen. Abdomen soft, non-tender. Symphysiofundal height is 30 centimeter. Longitudinal like phallic presentation. Estimated fetal weight is 2.5 to 2.8 kg. Liker seems reduced. Fetal heart rate 130 to 140 beats per minute. No palpable contraction at the time of examination.
ये सब लोग palpable contractions क्यों देखते हैं at the time of examination?
डॉक्टर शाजिया नहीं बोलना.
Yeah, this is not part of routine examination.
ठीक है.
Until unless आपका patient preterm labor या lower abdominal pain के साथ है.
डॉक्टर शाजिया और कुछ हिस्ट्री और एग्जामिनेशन में आज मैंने ऐसा सब बोला. मैं कहा और कोई चीज हिस्ट्री और एग्जामिनेशन में
नहीं, अदरवाइज आपका हिस्ट्री एग्जामिनेशन ठीक है.
कंप्लेंट मैडम ठीक थी. रेज ब्लड प्रेशर. वो मैडम वो कहते हैं ना कि एवेल्युएशन एंड कंट्रोल ऑफ रेज ब्लड प्रेशर किसी ने पहले बताया था, तो अब ये वाली ठीक है या वो मैडम? ये जो कंप्लेंट होती है ये रेज ब्लड प्रेशर ही आएगी इसमें, रिड्यूस्ड अमाउंट ऑफ फ्लूइड अराउंड द बेबी. ठीक है मैडम. इन्वेस्टिगेशंस. ब्लड ग्रुप विद आरएच फैक्टर.
ग्रुप ए पॉजिटिव.
Complete blood count with date in which I want hemoglobin in gram per deciliter.
Hemoglobin 8 gram per
TLC and
deciliter.
paper.
TLC platelets normal.
Red blood cell indices.
MCV 52, MCH 25 and MCHC 30.
Peripheral smear.
Peripheral smear not done.
Serum ferritin.
Serum ferritin not available.
Random blood sugar level.
120.
Hepatitis B surface antigen and anti-HCV.
Negative.
Urine complete examination for biochemistry and microscopy.
Urine complete examination, abdomen is 2 plus 1 to 2% glucose need.
Liver function test.
LFTs are normal.
Renal function test.
Also normal.
24-hour urinary protein.
24-hour urinary protein shows 400 milligram protein.
Dating scan.
Dating scan not available.
Anomaly scan.
No gross fetal anomaly.
Recent obstetric scan.
We'll discuss later.
Madam, BP record.
Blood pressure is controlled.
And treatment sheet.
She is taking methylopar 500 milligram QID.
Yes, ma'am. Yes, ma'am. See.
जी डॉक्टर सदफ, what else you want?
Yes, ma'am. हो गया.
Summarize.
20-year-old married for 2 years, primary Ravda at 35 weeks with preeclampsia, blood pressure controlled on 500 methyl dopa 500 milligram 4 times a day, and reduced liquor and iron deficiency and anemia.
Okay, how will you manage her?
She is pale and madam, I need her obstetric scan and
Recent
serum
ultrasound
ferritin
her
to
AFI
manage my
is
patient.
2, longitudinal cephalic and all other parameters are normal.
Easy. Madam, Doppler scan.
ST ratio is 3.1.
Yes, ma'am. Madam, I will explain the diagnosis to the couple that she is having preeclampsia and reduced liquor. This is high risk pregnancy, and also she is having anemia, and explain the fetal-maternal risk associated with her disease. I will complete my investigations. I will do her serum ferritin level and peripheral smear.
Okay, then.
My aim of management is to correct her anemia and control her blood and to monitor her blood pressure and to minimize the complications and to prolong the pregnancy as close to term as possible. Provided fetal-maternal condition remains satisfactory. And I will discuss contraception, breastfeeding, and her time and mode of delivery with her. As her
Why you have
hemoglobin
not
is
discussed with her time and mode of delivery till now? And why you have not discussed contraception? What is gestation of your patient today?
Madam 35 weeks.
When will you discuss?
Madam 36.
Is this discussion
नहीं
contraindicated
madam.
at 35 weeks? एग्जाम में आपके पास पेशेंट ने दोबारा नहीं आना.
No madam. Yes. मैडम उसका मेरे पास ब्लड प्रेशर रिकॉर्ड नहीं था और 24 आवर यूनिप्रोटीन अब आपने दिए हैं इस वजह से.
Blood pressure record or 24-hour urinary protein is an indication or contraindication for contraception.
मैडम नहीं कॉन्ट्रासेप्शन के लिए नहीं.
Then Is it a
Yes, ma'am.
indication or
Yes,
contraindication for
ma'am.
mode of delivery? Okay, manager.
As her hemoglobin is 8 gram per deciliter, I will give her 2 units of blood and
Will you
give
give
her
her
iron
whole blood?
infusions on. Yes, ma'am.
Will you give her whole blood or pack cell volume?
Ma'am, pack cell volume.
Okay, then
And will give her iron infusions on alternate days according to her need, as she is non-compliant. And I will do her blood pressure record 4 times a day and repeat her investigations weekly, and fetal kick count chart daily, CTG and biophysical twice weekly, and growth scan fortnightly. At
when
37
will you
weeks,
deliver her?
at 37 weeks, I will
तो
reassess my
आपने
patient
35
by
वीक्स पे
taking
है,
her history
47 पे आपने डिलीवर करवाना है, तो कितने फोर्टनाइटली अल्ट्रासाउंड होंगे?
2 पे मैम अगर मैं करूँगी
डिस्ट्रेस हो जाए तो इमरजेंसी सेक्शन कर दो. हैव यू डिस्कस विद योर पेशेंट व्हाट शी वांट्स?
Madam, I will discuss with my patient and will tell about the risks of decreased liquor,
Okay,
cord
then.
compression, and fetal distress.
हम्म.
Then plan elective cesarean section.
अगर करना ही इलेक्टिव था तो फिर पेशेंट से डिस्कशन क्या की और क्यों की? Is trial of labor contraindicated on AFI2?
नो मैम, अगर वो लेना चाहेगी तो फिर उसको दे दूंगी, और एनेस्थेटिस्ट को विद लो थ्रेशोल्ड फॉर सिजेरियन सेक्शन, और मैडम उसमें एनेस्थेटिस्ट और पीडियाट्रिशियन को इन्वॉल्व करके और विजिलेंट मॉनिटरिंग करके मैडम, और ओटी जो है वो ऑपरेशन थिएटर को जो है ना वो करके इन हैंड अवेलेबिलिटी उसकी देख के जो है ना मैडम, उसको मैं लो थ्रेशोल्ड पे जो है वो कर दूंगी.
ओके बेटा. अगर आपने अभी मरीज से पूछा होता कि अगर कोई मसला ना हुआ और नॉर्मल डिलीवरी हो सकती हुई तो क्या आप नॉर्मल डिलीवरी करवाना चाहेंगी, और वो कहती है जी डॉक्टर साहबा मैं करवाना चाहती हूँ, तो आपकी जिंदगी आसान हो जानी थी. एज आई हैव डिस्कस्ड विद माय पेशेंट एंड इफ देयर विल बी नो कॉन्ट्राइंडिकेशन टू वेजाइनल डिलीवरी एट 37 वीक्स देन आई विल वेट फॉर स्पॉन्टेनियस ऑनसेट ऑफ लेबर टिल 37 वीक्स and once she will go into labor I will involve pediatrician anesthetist and monitor her labor with one-to-one monitoring and maintain partogram analgesia and deliver her. And second possibility was if she does not go into labor at 37 weeks, then you will discuss with your patient.
है माइल्ड
प्रीक्लेम्शिया है ना?
माइल्ड है, इसे तो 37 वीक्स
Preeclampsia,
पे कर देंगे.
eclampsia or severe hypertension are not contraindications to vaginal delivery.
यस मैम, यस मैम.